Hello everyone, this is Ethio Health Tube. Today we will talking about seizure. Seizure. So, what is seizure? Seizure is abnormal electrical activity in the brain or central nervous system. Seizure is abnormal electrical activity in the brain or in the central nervous system, which is followed by, or which may followed by, which is followed by 1. Abnormal motor experience. 2. Which may followed by 1. Abnormal motor experience or 2. Abnormal sensory experience or 3. Abnormal psychomotor experience. So, seizure is abnormal electrical activity in the brain, which may followed by abnormal motor experience, abnormal sensory experience, or abnormal psychomotor experience because of all abnormal electrical activity in the brain or in the CNS is not seizure. To say seizure is followed by one thing or a real problem is abnormal electrical activity in the brain, which may followed by abnormal motor experience, abnormal sensory experience, and abnormal psychomotor experience. When we talk about abnormal motor experience, the first thing, there are neurons in the brain which is agonist, and there are neurons in the brain which is antagonist. During abnormal motor experience, the first one is tonic or body stiffness. During tonic, agonist and antagonist is simultaneously firing. During that, the patient looks like stiffness. Opposite to the clonic, if the patient first agonist fires, then antagonist, the patient is agonist and antagonist alternatively firing. This is called clonic. Very jerky. The patient looks like jerky. This one. And the third, if the patient agonist and antagonists are simultaneously firing, then agonist and antagonists are alternatively firing. First, agonist and antagonist simultaneously firing, then agonist and antagonist alternatively firing. This is called tonic-clonic. So, the patient looks like first agonist and antagonist are simultaneously firing. That means agonist and antagonist ምንድን ነው? በተመሳሳይ ጊዜ ነው ፋየር ያደረጉት። የዛኔ ፔሸንት ምን ይሆናል? Looks like stiffness. Then አጎኒስት ኤንድ አንታጎኒስት አር አልተርኔቲቭሊ ፋይሪንግ ፈርስት አጎኒስት ዘን አንታጎኒስት ማለት ነው። አልተርኔቲቭሊ ስንል የዛኔ ፔሸንት ምን ይሆናል? ላይክ ጀርኪ። ሶ ቶኒክ ክሎኒክ ሚንስ ፈርስት the patient is stiff, the patient is stiff, then the patient going to what? Jerky, the patient going to jerky. This is called tonic clonic. And fourth atonic. In some patients there are loss of tones looks like lump, that this is called atonic. Loss of tone. ለምሳሌ ያነበበ ከሆነ እንዳለ ፌል ያደርጋል ማለት ነው። ቶንን ያጣል። ቁጭ ብሎም ከሆነ እንዳለ ዝም ብሎ ወድቆ ልፍስፍስ ይላል ማለት ነው። ይሄ ኤቶኒክ ነው። ቶንን ማጣት ማለት ነው። ጥንካሬ ማጣት። ነምበር 5 in some patient abnormal motor experience which is myoclonic single jerk. We didn't confuse myoclonic with clonic. Clonic is repetitive jerking. Myoclonic is single jerking. Looks like single jerking. Clonic is repetitive jerking. So we didn't confuse these two things. So we will revise it. If the patient body stiffs, tonic. If the patient body jerks, clonic. If the patient very stiff, then jerky, tonic clonic. If the patient single jerky, myoclonic. If the patient loss of tone, atonic. What about epilepsy? Epilepsy is spontaneously recurrent episodes of seizure. Spontaneously again and again episodes of seizure, or spontaneously repetitive episodes of seizure. This is simple definition. Epilepsy is abnormal electrical activity in the brain or in the central nervous system which is spontaneously again and again episodes of a seizure. This is the definition of epilepsy.